Thanks for joining us on EMN 5 today. Our topic is Quinckes edema. Makes for a great boards question and also a pretty neat patient presentation. So let's pretend you did not know what this topic was, and let's start out with the case. So we have a 27-year-old male, comes in around 6 in the morning, said he woke up, was having some difficulty swallowing. He has a spit cup in front of him that he keeps spitting into and says that he feels like his throat is swelling. However, the patient actually looks good. He's in no acute distress, no rash, no hives, and on further investigation, he actually says he's gotten this before, and he just got a shot. So on exam, his lips, mouth are normal. He does seem to be drooling a little bit, but when you actually ask him to swallow, he can. His voice is a little muffled, no fever, he looks non-toxic. So you have him open his mouth to take a look at his throat, and this is what you see. Very odd. What in the world is that? So this is Quinckes edema. It's an isolated angioedema of the uvula, and uvula meaning grape. So the differential for uvular edema can include infectious causes. Think about bacterial or sometimes Candida, HSV, Coxsackie. Make sure you ask the patient about any trauma history. This is usually iatrogenic. See if they have a recent endoscopy, adenoidectomy, if they've been just hospitalized and were intubated. Another thing to ask about is any exposure to chemicals, and inhalation injury could certainly cause some uvular edema. And certainly an allergic reaction could cause some airway swelling as well. So Quinckes edema is an IgE-mediated histamine reaction. As with all airway swelling, you always need to think of your ABCs, think of getting that airway early and criking the patient if you think that they are at significant compromise. Otherwise, in this patient who seemed very calm, his edema actually seemed stable, and he had no other evidence of an allergic reaction, you can consider the following medications. So Benadryl, I would do IV in this case. You don't really want him swallowing medications. So that's going to be an antihistamine, H1. Ranitidine is an H2 antihistamine. You can use that as an adjunct to the Benadryl. Then I would always give a steroid. Usually methylprednisone 125 milligrams IV is a good place to start. And in a patient who's in any kind of distress or you're concerned about that airway or have significant edema, I would always consider some sub-Q epi 1 to 1,000.3 milligrams as an early treatment, and probably a pretty good choice in this patient who is a young, otherwise healthy guy. So 3 to remember, Quinckes edema is isolated angioedema of the uvula. You're going to treat it pretty much like regular angioedema. Make sure and watch that airway though. And always consider other things on the differential, such as infection, trauma, or chemical exposure. And thanks again for joining us on EMN 5 today.